hi, and I hope whatever time of day you're watching this video you are well and that you are surviving the current pressures that are occurring in primary care. I want to talk to you briefly this morning about accreditation of the PCN as a learning environment. Historically, training practices for those undertaking GP training have been accredited on an individual level, but as with all things NHS, the shift is towards the PCN being the unit of currency, and therefore the PCN is now going to be accredited as the learning environment. This is a national initiative and it will be occurring countrywide, and it will be a single one-off experience. So once a PCN is accredited, they are accredited going forward. The reason for the accreditation, it's part of Health Education England's quality control process. So we need to know that students and learners from any background are having a good experience, that they are safe, that patients are safe, and that they're having a positive learning experience. And really the accreditation is part of the assurance of that process. If learner experience is poor, then that will trigger a learning environment review, and we'll talk a little bit about that later. So the practice may have students from Christchurch, Canterbury, or GP trainees, as we've said. So a practice or a PCN might have trainee nurse associates, physicians associates in training, paramedic practitioners in training, medical students, GP trainees, etc., etc. But also we are very mindful of the practice being a learning environment for all staff members. So we're keen that this process can be used to reflect on the learning environment for all learners, because all of our staff undertake annual appraisal. We are all continuing to learn professionally, irrespective of our role within the practice. So what is involved in the process of accreditation? Well, there are two basic elements to it. Number one, completion of a form, and number two, a meeting to discuss the contents of that form, and also to put the meat on the bone so that individual practices have an opportunity to talk about their practice and the submission that they have made on the accreditation form. We're going to ask our GP education leads, our CEFs as we call them, and our multi-professional leads, our MPLs, who we have in each PCN, to take a lead in the process. But we will need probably one nominated individual from each constituent practice to complete the form on behalf of their practice. It will then be the job of the CEF and the multi-professional lead to amalgamate all the contents of those submissions into one form, and that will then be submitted to Health Education England. That will then trigger a meeting, which will probably be led by myself and maybe some other HEE representatives, and we hope that there will be somebody present from each practice. They may be an obvious GP education lead, might be practice manager, but somebody who is able to talk about the practice with authority and experience about the environment as a learning environment as they understand it. I would emphasise that on completion of the form that it is done bearing in mind that we are not just looking at GP training, we are not just looking at Kent Medway medical students, we are looking at all learners, both those from university settings such as Christ Church Canterbury, but also staff who, as I say, will be having annual appraisal and will be developing themselves in many, many ways. So that in essence is it. I did mention that if there are difficulties or adverse experiences, that will trigger a learning environment review. That would happen at a practice level, wherever the learner is hosted, then the visit would be to that individual practice. And such reviews will be triggered by complaints from learners, possibly CQC making judgments around inadequacy, or by a learner leaving the environment. Now, we have had some experience of this in West Kent to date, as we've had a couple of advanced nurse practitioner students who have moved on, and this triggers a learning environment review. And I have to say that the experience has been very positive. I think that we from Health Education England have learnt a lot, and hopefully the practices have as well. But that is the consequence of anything that rings alarm bells within the system, if you like. So thank you for engaging. We are already seeing PCNs who are beginning to join the queue to get themselves accredited, and so please do be in contact when you want to take that process forward. I will I will attach the form to this email where I'm sharing the link so that you can see exactly what is required. Please do let me know if you've got any queries, and I will be happy to address them and to help support you in the accreditation process. Thank you very much.